Welcome Health Skills. Today I show you about looking at major diseases in daily life. 3 feet psoriasis. Psoriasis is characterized by erythema, a symptom of reddening of the skin, and silvery white scales, a symptom of white dead skin cells. The cause of the disease is not clearly identified. However, skin trauma, dry climate, drinking and stress are known to aggravate symptoms, and it is not a contagious disease. Symptoms often appear in areas that are frequently stimulated, such as elbows and knees, and in the buttocks, often appearing symmetrically and with clear boundaries. The main symptoms of psoriasis. Psoriasis usually occurs symmetrically, but it occurs in areas that receive a lot of stimulation, such as the extension of the limbs, especially the shin, elbows, knees, sacrum, and scalp. In the beginning, small red, millet-like rashes, pimples, appear on the skin, which gradually grow to the size of walnuts or eggs. After that, a new rash like millet develops around it, which also grows and merges with each other to eventually become a rash the size of a large egg or palm. On top of it, scales like white scales are piled up. Psoriasis usually takes the form of plaques covered with scales, and petechia appear when the scales are removed. This is a specific symptom of psoriasis. In rare cases of pustular psoriasis, pustules usually appear. Nail lesions are found in 30 to 50% of patients with psoriasis. Several lesions may appear, including nail depression *, nail detachment, nail thickening, subungual hyperkeratosis, and subungual tan. * toenails, jiao jia, refers to both fingernails and toenails. Psoriasis treatment. Treatment methods for psoriasis can be largely divided into local treatment, phototherapy, and systemic treatment. Topical treatment is used for mild psoriasis, and systemic treatment or phototherapy is used for severe psoriasis. Filled-up pointing triangle topical treatment. Topical treatment is a treatment in which drugs are applied directly to the diseased area. Corticosteroids, vitamin D derivatives, and moisturizers are applied to the skin every day. However, if a strong corticosteroid drug is applied for too long, various side effects such as telangiectasia, dilatation, and skin atrophy may occur, so it should be used with caution under the guidance of a doctor. Filled-up pointing triangle systemic treatment. Systemic treatment is used for patients with severe psoriasis. In consideration of the side effects of the drug, it is administered after considering children, pregnant women, liver or kidney disease, and patient compliance. For systemic treatment, drugs such as synthetic derivatives of vitamin A, immunosuppressants such as cyclosporin, methotrexate, and steroids are used. Filled-up pointing triangle phototherapy. Phototherapy is a method of treating psoriasis using ultraviolet light, and is mainly used for extensive psoriasis. It is treated with photochemotherapy called PUVA or long wavelength or short wavelength ultraviolet B light. Recently, phototherapy using short wavelength ultraviolet B is the most commonly used. PUVA treatment involves taking a drug called psoralen in combination with ultraviolet therapy to enhance the effectiveness of phototherapy. Although it has excellent therapeutic effects, it cannot be used for children, pregnant women, hypertensive patients, and epileptic patients. The medications you take during phototherapy can cause side effects such as stomach upset, nausea, and dizziness. In addition, there are inconveniences such as having to wear UV blocking glasses to protect the eyes for about 2 days after treatment. As a result, the frequency of use has decreased in recent years. Short wavelength UVB treatment is a convenient treatment that does not require wearing sunscreen glasses after treatment and does not require medication. Therefore, it can be used by children and pregnant women. The treatment effect is almost comparable to PUVA, and it is the most used recently. However, care must be taken as it can cause sunburn in the process of increasing the amount of ultraviolet rays. More recently, excimer lasers are used to treat psoriasis. It has the advantage of being able to provide strong light at once, but has the disadvantage of narrowing the area that can be irradiated at once. In general, rather than treating alone, drugs, ointments, and ultraviolet rays are used in combination. Doctors may change treatment every 12 to 24 months to prevent the treatment from becoming less effective and reduce the risk of side effects. Precautions for patients with psoriasis. Patients with psoriasis should be careful not to injure the skin, as new lesions may develop at the wound site if the skin is rubbed or scratched. For this reason, even when taking a bath, you should not push the dirt excessively. Streptococcal infections such as sore throat or tonsillitis should be avoided, and mental stress can also make psoriasis worse. You should also avoid using medications that aggravate psoriasis. Psoriasis patients are sensitive to the season, i.e. to the climate. Especially in winter, it gets worse, so you need to treat it with special care.